It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
Here we go, episode 4.
Hey, Dr. T. How are you today?
Good. Lisa, how was your day today?
It was quiet, mostly spent indoors. And what about you?
Seems to be the usual answer you're getting from people these days.
That's right.
One of the things is the campaign to stay inside. I wanted to put a caveat on that for our listeners and just say that if you want to go outside for a walk and avoid close contact and close proximity next to other people who are enjoying the outdoors, that's okay. You can always wear your gloves and your mask as well for extra precaution. But we need to balance between the mental health aspect of the social isolation campaign and be able to get some of the UV rays that we know are very good for us in many different ways.
Another good thing, though, to keep in mind when going outside, especially if you live in a population dense area like the center of a city, is to try and go outside during times when there aren't a lot of other people out there. We just want to avoid parks being crowded. There are reasons why parking lots are being blocked off and why play structures are being roped off because we can't avoid there being too many people on there. If you live in suburbia or in a rural area, you really have an advantage here in terms of spending really safe outdoor time.
That's right. Great advice. So basically, keep your feet moving, everybody. Don't stand stagnant outside and remain a vector for all my scientifically oriented listeners.
Oh my, are you going to explain that joke to the rest of us?
Sorry about that. Let's keep going here. Let's go with the correction of last week. I misspoke when we were talking about the total number of deaths around the world. I said over 100,000. In fact, it was over 800,000. And that takes us into our numbers as of today, which is April 7th. And currently we're sitting at just about 1.4 million cases around the world. And we're now recording almost 81,000 deaths. And more to come, folks.
Unfortunately, yes, there is no way to avoid that there will be more deaths, but there are ways to avoid how many, or there are ways to reduce the total number that will happen.
And part of it is being on the same page and understanding some of the things that we can do to mitigate risks without acting irrationally. So that brings us into episode 4, our second remote episode, and we're going to do our call to action.
Great. All right. Where should we start? There's so many actors in this call to action.
Well, let's start with preface. Let's start by saying that we're going to kind of brush up at the different levels of action that we're targeting. So, we'll kind of go through government, business, and individual calls of action. And we're going to set up the stage for our future episodes. We've decided to extend our mini series, and we're going to start to get some professional and expert guests to join us, which is really exciting.
That's right. As we extend our self-isolation and are further into this together, we're going to extend our series here and be right with you.
Yeah. So should we get started?
Absolutely. I can't wait to hear what you have to say today. And then to interrupt you while you're saying it.
Please do so and ask me any questions as they may arise in that brilliant mind of yours, Lisa.
Oh, well,
and Lisa, right? So let's talk about the main message we want to send to governments around the world. Last episode, in episode 3, we talked about uncertainty. And what's the best way to tackle uncertainty? Well, let's try and present some certainty to the picture. So the real message is we want this yesterday. We want testing. And more specifically, we want antibody testing. What we're doing currently with the swabs that we take from people's mouths or nose, what we call oropharyngeal swabs or nasopharyngeal swabs, are checking for what's called an antigen. And an antigen is essentially the virus itself, or a protein that the virus produces that we're able to detect with the tests.
Okay, so that's an antigen.
That's an antigen. So the antigen is a representative of the pathogen in question. of the bug, whether it's a virus or a parasite or a bacteria or a fungus. Okay.
Got it.
So we're really checking for antigens with the swabs. We're seeing, is the virus there now in this individual who has symptoms? Does that make
Okay,
sense?
it does. And so what's different between an antigen and an antibody?
So the antibody represents our host immune response to any bug or pathogen that we may encounter. So it's basically the proteins that our bodies create to target and try to combat the virus in question. And once somebody has immunity to any kind of bug out there, we're really talking about the fact that they have antibodies in their blood for that specific pathogen.
Okay, got it. So, to reiterate it for everyone who isn't a science nerd out there, we're saying that an antigen is the virus's representative of its existence in our body, and an antibody is our body's representative of that virus's existence in our body.
Yes, past or present in terms
Okay,
of our
either way.
antibody response.
Mm,
So you can actually have the antigen disappear, which is another way of saying that we've recovered from the illness, but the antibodies remain in our blood. So it serves as almost like it's almost as if our immune system has a memory of sorts. Isn't that fascinating?
yeah, it's totally fascinating. My question is sort of, is the antigen, does it disappear then once we know that somebody um, is completely recovered and no longer sort of can communicate the disease to anybody else? So
That's
we know that
exactly
they're
right.
safe to go back out there?
That we know that there's no active illness or disease going on, that the bug or the virus is no longer in the person's system or in that part of their body.
Got it.
Does that make sense?
Yeah, it
So
does.
really the message in terms of calling to action is we need antibody testing so that we start to amass population statistics about immunity to the coronavirus, and thereby we can start to implement policies that will help stimulate our economies again while minimizing the human costs. So for example, we know that people who carry these antibodies, they would be able to go back to the workforce and they're not at risk of either spreading the disease or catching the disease. So that's very important, and we want this as soon as possible. And I'm very confident that governments and companies around the world are working on a way to detect antibodies in the blood, or what we call serology testing.
Right. And isn't it important for other than just the workforce just to know that, maybe you shouldn't be the one going out grocery shopping if you've tested positive, but you're asymptomatic?
Definitely a lot of applications in the household or at the individual level.
Mhm,
Absolutely.
mhm.
So,
I heard recently that in the last few days, Iceland has randomly tested 5% of their population, which I found was interesting. And of those who tested positive for COVID, 50% of them were asymptomatic. So if we take that data, however little it is, and extrapolate it to consider that if we tested everybody for COVID and 50% of them that tested positive were asymptomatic, that does explain why things are spreading so quickly
and this is
in
new
places.
information that we're starting to become more aware of. There was another study in China in Ground Zero, and they found very similar numbers in the sense that there are a lot of asymptomatic carriers, people who don't have any symptoms and yet carry the disease and can shed and spread the disease. And so now we're starting to see an emphasis at the individual level. If we want to talk about an individual call to action, wear your masks. It is important to help prevent the spread of the disease and to protect you individually. But we know that since many of us can be walking around with the virus and show no signs of it, we need to wear our masks.
Yeah. And I think that's so important. I don't think that's something that people realize that they can be so dangerous to others
And
if
it's
they're feeling
unbelievable,
fine.
and it's unreal how quickly things are changing, how we're just starting to realize this now about the virus, and we're going to continue to learn new information that may change the way we behave.
Right. Well, like Oprah always says, when you know better, you do better. So, make like Oprah and do better, guys.
Make like
That's
Oprah,
it.
you
Wear
never
a
go
mask.
wrong. Make like Oprah,
That's
you never go
right.
wrong with that mentality,
Never.
right? Let's talk about the small business and corporate aspects in terms of ways that we need to mitigate this crisis. And it comes down to one word. It comes down to the word pivot. It's time to go back to those supply and demand curves and our business models, and to adapt to the ways that we need to provide more remote services and more remote products and the delivery of those products. And we need to find where there are gaps in the market to fill the voids. And we need to, for the time being at least, rely less on those international supply chains that could be breaking down because of the shutdown, and start to try to stimulate local economies. And so, really, the call to action is, don't shut down completely. Regroup. If you need to shut down for a while, to regroup and reallocate resources so that you're contributing to the economy as we know it today, which is completely different than it was just a few weeks ago. That would be my call to action to the businesses out there, thereby allowing us to create jobs in a safe way and mitigate this economic crisis.
Or, at the very least, maintain the jobs that are already there. And and not make the situation any worse than it is. I mean, it's great that there are all of these sort of benefits that the government is giving us, but the next few years are going to be really, really difficult come tax season if we don't do everything we can in the meantime to not rely on those things.
Absolutely. We need to empower our populace and help our governments, because governments can only do so much. We're going to have to feel some of that pain. But again, we go back to episode 3 when we talked about how are we going to react to uncertainty? Are we going to accept our fate, or are we going to find purpose by other means and adapt our skill sets? And we have this incredible human capacity to do so.
That's right. So, do you have an example of how you've had to adapt
Well, it's a good
or
question.
fill the void, so to speak?
Well, I can speak to the way our services that we're providing in the medical industry are changing. We are definitely moving more towards a remote-based model of care, and there's a big initiative to start to reduce the risk of the spread of infections in healthcare related places, what we call nosocomial infections or iatrogenic infections. And, one of the ways we're doing this is limiting visits to the clinic for only essential visits, visits that require some kind of physical contact between a physician and their client. Otherwise, we're really starting to shift to remote video based models of care. And we're finding that, at least in the day to day and anecdotally, that we're able to function at a very, very high level and provide a comparable standard of care. I do think that part of our research also needs to adapt, because at the end of the day, medicine takes pride in adhering to the scientific method. So we're going to need to figure out ways of studying remote based models of care compared to our more traditional models of care.
That's right. So evidence is so important in medicine, and we're all so grateful for that, which is why, certain medications aren't just sort of being given out to the public, even though they may have some rumor of working for COVID, because you need evidence to proceed with medicine, right? Because otherwise you do harm. And I've never taken the Hippocratic Oath, but I know that that's basically it. Don't do harm,
Do
right?
no harm is the number one tenet of the
There you
Hippocratic
go.
Oath. And you're absolutely right. You're talking about research, and we're really talking about randomized controlled trials that are blinded with comparison of one model or medication to a placebo or traditional model of care. So, lots to come. And again, this is something that's going to change. And I think we're going to start to see the redefinition of the way we provide healthcare services. And you're going to start to see this also happen in the private sector when it comes to our business world. Yeah.
I mean, the results will be exciting. Right now, it's hard to get through it, but the results won't all be negative. Some of them will be very exciting and interesting, guys.
The
So don't forget
adversity
that.
serves as a wonderful opportunity. And I truly believe that. And
Yeah.
that takes us into discussing the individual mandate, the call to action. It's time to rediscover yourself. The silver lining from the social isolation campaign is that all of a sudden we have time that we never imagined we would have before. So focus on self improvement. What do you need to do to feel purpose, to feel good in your life? Refine your skill set, spend time with those that are closest to you. This is time that you may never have again. And the key word I want to emphasize is structure. I truly believe that in order to find purpose, one needs structure. So define your days and see how you're going to spend that time in a structured way and commit your time to certain activities. And you don't need to work to have purpose. This is the key word to remember. But in order to feel that purpose, you need to structure and allocate your skills and resources appropriately.
That's right. And while you're doing that, I just want to remind everyone to have some compassion for yourself, because this is a difficult time. And as much as we are being told by every listicle out there that these are the 10 things you should be doing while you are self quarantining, if you're not trying to learn Japanese or finally finish Moby Dick or whatever it happens to be, that's okay. It's okay to be quiet and restful and to just not be able to finish a task sometimes because you're just feeling a little bit overwhelmed with the state of the world. What I think is important to remember, like you said, Dr. T, is that it's not just about work. Purpose is not just about work. So replying to someone's text message or having a FaceTime call with an elderly relative who may be self isolating on their own is purposeful. It's wonderful, and it's tapping into your central humanity, which is what I think is a huge call to action for everyone, is to remember your humanity. So
Bring it
whether you're
back to the roots.
yes,
Bring
exactly.
it
So
back
whether
to
you're
your
staying at
roots
home to protect everybody, that is your humanity shining through. And while you're doing that, connect with people in a new way.
and connect with yourself in a new way.
That's right.
And, I'm going to extend what you said about it's okay to have quiet time, especially to the parents and the parents of young children out there. It's okay for your toddler to sit in front of a book and occupy himself and entertain himself without your active engagement. And you shouldn't attach any guilt to those moments that you need to spend quietly aside your child, because as our children are held from childcare and schools, we're going to be spending a lot more time with them, at least for this near foreseeable future. So just take what Lisa said about being kind to yourself and reconnecting with yourself and allowing your mind to slow down, and don't allow feelings of guilt and obligations to others, including your children, interfere with that. Just
Right.
allocate and balance, right?
That's right. And let's save feelings of guilt for when you actually do something wrong
Yeah,
and
I
not
like
just
that.
for,
I like
something
that.
that doesn't exist.
Yeah, and when you did something wrong. That's
That's
the
right.
human conscience, which was exciting because next week we're going to have our first guest. We're going to have a psychiatrist come and join us and touch base with us on
What a
social
nice
isolation.
surprise.
Isn't that nice?
Yes.
Social isolation and how we can mitigate the effects it can have on our mental health, and how to expand on these ideas that we brought up today. And I believe the episode after that, we're going to have physiotherapist Tara join us, and she's going to talk to us about our physical and musculoskeletal health while we're indoors and more restricted from engaging in activities at the gym or playing sports and things like that. So we have a lot more coming. Very exciting.
That's amazing. I need both of those things desperately. And I'm, even if next week is a surprise intervention for me, I'm okay. It's fine.
Hold your breath.
You
Hold
know?
your breath,
Yeah.
everybody. Episode 5, Lisa's intervention.
That's right. I'm not sure what we're intervening about, but I'll come up with something by next
We'll
week.
figure it out. But for now, we say take care, stay safe, and take care of yourselves, everybody.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.